for improving midwifery education. And we work together at the global level to try to support countries, institutions, midwives, educators around the world. We're delighted to bring many of the AIME organisations and panellists today to this webinar, which is about developing midwife faculty. And we're introducing the ICM's Global Standards for Midwife Faculty Development. Our Chief Executive, Anna Afuglas, will be joining us towards the end of the webinar. You've got myself, Kate Stringer, Midwife Advisor at the ICM, Duncan Chicago, who's the Technical Specialist for Midwifery at UNFPA Global, Rachel Smith, Senior Midwifery Education and Development Specialist at Burnett Institute, Marlin Bogren, Professor at Gothenburg University in Sweden, and Asmita Eskaria, Senior Education Implementation Manager from Ladell Global Health. And the presenters today are going to share examples about how the ICM Global Standards can be used, how they've been developed, and what does research say about midwife faculty development and midwifery educators worldwide. As Bruno's already touched on, we'd love to know a bit more about you. It's really great to hear and understand where people are from today and what you're hoping to learn. Please pop your questions in the chat as we go through the webinar, and there will be time at the end to answer some of these questions. So just an outline of the webinar today. We're going to talk through the recent systematic review, which tells us a lot about midwife faculty in low and middle income countries. We're going to go through the faculty development process. So how are they developed and why? We're going to showcase what the faculty development standards stand for and the different categories within them, and share some examples around how they're being used around the world in different faculty development programs. And we're going to talk about how you could use the faculty standards in research and implementation programs to make sure you are benchmarking and assessing your programs against global standards. And as I've said already, hopefully we'll have time for Q&A at the end of the session. So now over to you, Duncan, for the first presentation.
Thank you so much, Kate, and warm greetings to everyone wherever you are. I'm Duncan Shikuku, and I'm presenting this work on behalf of my fellow co-authors, Dr. Sarah Baziv and Professor Charles AIME. And we are looking at the National Continuous Professional Development Programs for midwifery educators and evaluate their effectiveness in low and middle income countries, which is a systematic review that we conducted and published last year. Next. Yeah, so I'll basically give just us a glimpse of what we did and share some of the outstanding results from this and what this means for us in the webinar and the global community. Next. And so as a background, we all understand that continuous professional development, which is basically a means to strengthen educators' competencies or each individual's competencies to improve practice, is greatly needed, and it is crucial for us to improve our practices, enhance our competencies, and this is key in terms of reducing the maternal mortality as a result of the improved quality of care, given that we've been able to achieve our improved outcomes. And although there's need for us to strengthen our educator competencies, there's limited evidence of global standards as well as national standards that guide educators from the low middle income countries to improve their competencies, as well as limited opportunities for these educators to maintain their competencies. And for instance, if you look at WHO African region, just about a third of the countries at least have a mandatory CPD requirement for their healthcare workers, and this also applies to the educators. And when you look at the global survey that was done by ICM and published in the ICM State of the World Midwifery Report, there's also a feature there that we see that educators, despite the expected levels of competencies and proficiency in the WHO midwifery educator competencies, none of them felt competent in these specific areas. And some of the areas we are looking at here where we expect educators to be competent in, it includes practical things like in clinical teaching, theoretical teaching, assessment and evaluation of students, research, and many more. Next. And although this, with the results that we've shown from the background where there are limited opportunities, WHO provides a 7-step action to strengthen the quality of midwifery education. And if you look at the step number 5, this specifically talks about strengthening the faculty and the need for the faculty to be strengthened in their competencies so that they can be able to provide this quality education, which we will enhance the quality of practice. However, this is limited in low middle income countries where there's little information existing about the CPD opportunities and programs available within these countries where educators are able to attend and improve on their competencies. And therefore, we set out to carry out this systematic review to look at the approaches that are used in these settings, what are the content these educators are able to access, and also assess the effectiveness of these available programs in the low and middle income countries. Next. And as mentioned, this was a systematic review, which we did covering the period from 2000 to 2021. And we reviewed both the white literature and the gray literature. And in terms of the search terms, we included the relevant search terms touching on the midwifery educators. But because of the limited evidence available, we expanded the scope at least to also include the nurse midwives, who are majority of the providers in most of these low-income settings. And also in parts of Latin America where they do not use midwives, we expanded this to also include terminologies like the nurse educators in obstetric nursing. And we conducted a narrative synthesis because of the heterogeneity of the studies that were included in this systematic review. And what do we find as some of the results? Next slide, please. So when you look at overall from the low and middle income countries, we were able to only find 22 papers. And of these 22 papers, 14 of them were research publications with 8 reports, which were largely by UNFPA and 1 from ICM. And in terms of geographical coverage, low-income countries, as you can clearly see on your right, very few countries at least had an element of CPD programs being covered within their region. For instance, if you look at the whole of South America, we only had one country that at least had some element of CPD, and that is Brazil. And we see some countries like Bangladesh, Cambodia, at least having some good representation from the East. And in Africa, we have at least Somalia and Nigeria, where there has been some evidence of CPD work being conducted in those areas between 2000 and 2021. And this just highlights how this specific component of CPD has not received the needed attention within the globe, across the globe in low and middle income countries. Next slide, please. And when we look at the CPD approaches that were used, we see the twinning approach, where this is basically the international partnerships between the low-income countries and the high-income partners, where we are getting support, where countries from the low-income countries get to benefit from this collaboration, particularly from the high-income colleagues who are coming in as the capacity builders and applying the trainer approach, where these low-income countries are able to benefit in terms of the resources and also the skills that our colleagues from the high-income countries. And one key to note from this training approach from the studies we reviewed is that at least there was the joint design to allow for buy-in and implementation by colleagues from both the high-income countries and the low-income countries. And this is very key in terms of sustainability of these programs once the partners from the high-income countries leave the countries. And of our worry here is that we also see in terms of those CPDs that are directed by regulators, we see there is very limited evidence of these programs where only one study at least showed evidence of participation of national regulators. These are the nursing and midwifery councils in terms of supporting the CPD work. And this is critical because we expect these regulators to legitimize the CPD, and when they are not being involved, then this downgrades the whole thing that we are talking about CPD, because it needs that regulatory and policy support from the regulatory bodies. Next slide, please. And what were these educators able to access in terms of the CPD content? So as you will see from this figure, majority of the studies and the reports that we highlighted in this review, at least the educators were able to access some content around curriculum and teaching methodologies, at least some content to do with the teaching methodologies here, including clinical skills teaching, practical, at least on the practical part of the simulation. And these were also heavily witnessed within the type of skills that they were being taught in, where maternal and newborn skills were some of the key areas, and the overall sexual and reproductive health. Also, a key part, we see at least some evidence of these educators being exposed to research and training. And of note here is that some of the things these educators were exposed around this area includes things to do with the literature search and use of the computer technology in limited settings. And although we see this content, it's important to note that this content was cross-cutting across the papers, and also in terms of what we expect the educators to be good at. For instance, things to do with classroom and clinical teaching, students' assessments, and effective feedback. These were content that were less covered by all the CPD programs. And we acknowledge that these are critical WHO competencies expected of midwifery educators, but we see that evidence shows these were areas that were less likely covered, and therefore compromising the quality of teaching that we expect our educators to have in terms of theoretical teaching, as well as supporting clinical teaching for students to get the clinical competencies. Next, please. And how effective were these programs that educators were able to participate in? Overall, we see that very few studies were evaluated, at least in terms of the effectiveness of these. And also key to note is that although we have some that have been evaluated, it is important to mention that the evaluations largely relied on the subjective reported measures by the educators, the self-reporting, and largely qualitative. And this brings in the element where there is a possibility of bias, and therefore the need for robust methodologies, particularly the experimental designs that can be used at least to assess the effectiveness of some of these programs. And when we group the levels of assessments where it is important to look at these levels using the Kirkpatrick's model, we see that at the reactions level, which is very critical to ensure that participants are able to carry out, to continue accessing these programs, at least we see the 6 papers that were evaluated, majority of the educators reacted positively to the content that they were being taught. When you look at whether the programs they accessed led to any changes in knowledge and skills, it was good to acknowledge and appreciate that there was improvement in the knowledge, skills, and competencies of these educators who participated, and also in terms of their key application of these in delivering these updated curriculums which they were able to have. Now, the critical part, just a minute, please. So when we look at the behavior, whether these educators were able to transfer what they had learned from these education programs, we see that most of them were able at least to carry out, these programs were useful to them because they were able to lead to curricular reforms by these educators, and they were also able to use the acquired new teaching technologies from these educators, which they were eventually able to apply in their midwifery programs. And overall, we see changes in their qualifications as educators, career path where a majority of them received promotions and grew as academics as well as researchers. And it's also important to mention at this point that although this evaluation has been conducted partly on some of the studies, there is need for more evaluation around whether these programs are effective in terms of the student learning and the overall expected MNH health outcomes. And so in conclusion, what we are finding here from the results that we've seen is that there's really low evidence of midwifery educator specific programs within the low and middle income countries. And there's limited or low participation by the regulatory bodies, and there's need for them to participate more so that they can also participate in terms of addressing the policy issues so that educators can at least have access to these CPD programs to improve their competencies. And in terms of evaluation, all the studies relied on the self-reported measures from the educators, and therefore there's a need for robust experimental designs to be used. And overall, what these findings from these results have led to two main outputs. One of them being catalytic to the ICM Global Standards for Faculty Development, which are going to be presented in the next slide, and then also led to the development of the Midwifery Educator CPD program, which was piloted in Kenya and Nigeria, and these will be presented next week in the next webinar. Thank you so much. And for more details, next slide, please. So I've just given a summary of a 27-page systematic review, which I cannot give all the details. But for more details, you can access this paper. Is available online and free access in BMC Medical Education. Thank you so much, and back to you, Kate.
Thanks, Duncan. Lots to pick up with there. And as you touched on, we will be talking a little bit more about some of this work in the next webinar, and do ask any questions. But for now, I'm going to hand over to Rachel, who's just going to talk us through, how the faculty standards were developed, and then we'll go through the standards themselves. Thanks, Rachel.
Good morning, good afternoon, or if you are like me in the Pacific region, good middle of the night. Thank you for the introduction, and thank you, Duncan, for taking us through the need for these faculty development standards. I will provide an overview of the consensus-based process used to inform and support the development of these evidence-based global standards for midwifery faculty development. Next slide, Kate. In 2022, the International Confederation of Midwives was awarded a competitive grant by the Lardell Foundation to conduct an Utstein consensus-style meeting to agree on an approach to raising the standard of midwifery education globally. The Utstein process or methodology employs a modified nominal group technique to achieve consensus. Historically, Utstein meetings have focused on guidelines for clinical practice or education, and sometimes on setting research priorities. The consensus-style Utstein process generally brings together key players or experts in the field. The ICM Utstein meeting working group decided it was important to have global representation. So key players from each ICM region were identified through ICM networks and through research outputs that focused on strengthening midwifery education and midwifery educators. There was also representation from AIME, the Alliance for Improving Midwifery Education. Unfortunately, funding constraints prevented widespread participation in the initial meetings, but this was overcome in the broad consultation process. As part of the Utstein methodology, 2 web-based preparatory and exploratory meetings were held to present the current evidence through targeted discussions to identify the focus for the 2.5-day face-to-face Utstein consensus meeting. And it is so called as it is held at the beautiful Utstein Monastery in Stavanger in Norway, as you see on that slide image. Next slide. Thanks, Kate. Previous slide, sorry. The web-based meeting set out to address the following objectives: to discuss the issues experienced by midwifery faculty, to review the evidence and discussion on research priorities, to identify existing programs that contribute to the development of midwifery faculty, and to have a discussion on the strategies and solutions to support the development of midwifery faculty. Overall, the pre-meeting identified requirements for ensuring a sustained and continued focus on developing a strong and fit-for-purpose midwifery faculty. The experts identified the importance of developing global standards and processes that enable benchmarking of quality practice as a means to support and strengthen the development of midwifery faculty and therefore midwifery education. These pre-meeting discussions identified the focus for the face-to-face meeting, and that was the development of standards for midwifery faculty development. Next slide, please. And next slide, thanks, Kate. So the Utstein meeting process. Next slide, thanks, Kate. So the first activity for the face-to-face meeting was the identification of key principles that the standards for midwifery faculty development should be based on. Agreed principles were that the standards should be aligned with ICM Global Standards for midwifery education, that the standards should be inclusive and equitable, so they are accessible and applicable in diverse contexts. The standards should be grounded in high quality evidence. The standards should be adaptable and flexible so that they are suitable for varied cultural, institutional, and resource settings. That the standards should be clear and practical with actionable guidance that can be implemented in real-world contexts. That the standards should demonstrate respectful and rights-based learning principles. The standards be learner-centered. That they should be feasible and realistic for resource-constrained environments, and that they should encourage collaboration through promoting partnerships and multidisciplinary involvement. Next slide, please. Kate's going to take you through the categories for the faculty development standards, so I won't dwell on these now, but just so you're familiar with these. They are leadership, curriculum, resources, partnership and collaboration, learning and teaching, and maintenance of midwifery practice competence, and that they promote scholarly activities such as research. Next slide, please, Kate. Oh, there's one before that. The ICM core working group continued to meet. Oh, no, they didn't. Okay. Oh, Kate was going to take you through the development of the associated guidance for the standards. Okay, and final slide there. This was the Utstein Development Group, with special thanks to Lardell Global for the Utstein meeting opportunity and to all involved in the development and the consultation process. These standards are evidence-informed, collaboratively developed, and profession-specific, and will support a focus on the provision of high-quality midwifery education through supporting high-quality midwifery educators and faculty. Thank you.
Thanks, Rachel, for sharing the extensive process that the faculty standards went through. And so I'm now delighted to kind of talk you through the ICM Global Standards for Midwife Faculty Development. ICM has worked a lot in midwifery education over the last few years, but what we know is that midwifery education is absolutely reliant on midwifery educators having the skills, knowledge, and behaviours to be able to deliver quality midwifery education. And that means a commitment to us as educators for ongoing continual professional development to ensure that we remain current and up to date and able to deliver the midwifery education that students require and that will meet the needs of the local communities. So the ICM Global Standards for Midwife Faculty Development should always be used alongside the ICM Global Standards for Midwifery Education. Category 3 in the Global Standards for Education, actually Category 2 covers faculty, but the faculty development standards give much more detail about the professional development that midwife faculty require. The others have already touched on that actually what we can use the standards for is to set benchmarks and quality indicators for midwife faculty development. They help provide a framework for how or what elements need to be covered. We heard in Duncan's conversation that actually many faculty development programs just focus on one area, perhaps curriculum design, and maybe don't cover all of the other elements that midwife faculty require. ICM would advise that we always start with a needs assessment for individual midwife faculty or at an institutional level or regional or national level. What do midwife educators need and require in your setting? What do students need and require? And what are the health or maternity concerns in your area? And this can help provide some guidance in how to build your program using the faculty standards as a benchmark or a framework. So just a little touch on terminology. ICM uses the terminology faculty to include the whole group of individuals who may teach midwifery students in the midwifery program. But midwife faculty refers to those educators who are qualified midwives and primarily responsible for the majority of the teaching of midwives. These standards are designed for midwife faculty who should be the lead providers of midwifery education in all settings. So these are the ICM standards for midwife faculty development. There's 7 different categories and they cover leadership, partnership and collaboration, curriculum, learning and teaching, resources, maintaining midwifery practice competence, and research. And as Rachel touched on, these standards and categories were developed out of a global consensus building. So all of the global research that had been identified around midwifery education and midwifery faculty was looked at to come up with what are the main themes that midwife faculty require to be qualified and competent midwifery educators. You can have a look at the standards using the QR code here. And also my colleague Asmita is going to talk about a couple of the standards in her session. And then at next week's webinar, we're going to dedicate the whole session to category 6, which is maintaining midwifery practice competence, because we know this is one of the most challenging areas for midwives. How do we be midwife educators while also maintaining our clinical practice? So alongside the Global Standards for Faculty Development, we have a companion guide. And the companion guide provides additional guidance and evidence for organisations, individuals, governments, regulatory bodies around exactly what does the standard mean and how might this be applied. So what activities might you expect to find under this category and how you might be able to use them in practice. So for the ICM Global Standards Companion Guide, this is what it might look like. So category 1 is leadership. And we're looking for midwife faculty development should foster leadership in developing and delivering midwifery education programs. We know that midwife educators are critical in raising the profile of the midwifery profession, advocating for midwives and translating the philosophy of midwifery education to colleagues, to students, and to the wider community. And to be able to do that, midwife educators need appropriate leadership development and activities to help support them in their journey. So in the companion guide, you'll see some additional information under the guidelines, which can help you understand the standard in more detail. And then on the right might be a section that could be used for quality assurance at the institutional level, or guidance around what activities might you expect to find on a program that is meeting these global standards. And then just to remind you that the ICM's Global Standards for Midwife Faculty Development form part of a much wider suite of resources that the ICM calls the Midwifery Education Development Pathway. And under this pathway, we have a number of different documents that can help support midwifery educators in different areas of midwifery education. So we have an essential competencies mapping tool, so you can have a look at where the essential competencies might fit in your midwifery curriculum. We have additional supportive guides around assessment, clinical practice, what types of things that midwifery educators might need to look and develop in their own midwifery program. And we urge you to have a look at the Midwifery Education Development Pathway on the ICM website for more information on the resources available to you. And then just a quick signpost, coming soon in 2026 is the UNFPA and ICM Global Sample Curriculum for Pre-Service Midwifery Education. And this will be also a sample curriculum for direct entry midwifery programs or for post-nursing programs. And we hope that this resource, again, will be supportive for midwifery educators. It can help you review your own midwifery curriculums, identify where there may be gaps or areas that require strengthening. The sample curriculum will provide suggested resources and ensure that the curriculum meets all of the ICM essential competencies for midwifery practice. So watch this space for that resource coming in 2026. Now I'm just going to hand over to my colleague Asmita, who's going to talk through some of the standards in a bit more detail. Thanks, Asmita.
Thank you, Kate. I'm happy to be here today. Greetings to everyone. I'm Asmita Acharya from Ladle Global Health. Next, I will briefly touch upon the two categories, as Kate mentioned. Category 3, which is the curriculum, and then the next category, which is learning and teaching. So starting from the curriculum, evidence suggests that the integration of the ICM competencies into the curriculum is one of the crucial elements for implementing quality midwifery program. It is important that faculty have been trained and learn to integrate the ICM competencies in the curriculum. And the focus remains not only on the knowledge component, which is there in the ICM competencies, but also the skills and attitude aspect too. The ownership from the different midwifery associations, Ministry of Health, and different partners at country levels are also really important in this regard. We believe that the standard, along with the sample curriculum that Kate just talked about, would support the midwifery programs at country levels in developing a competency-based curriculum. And the sample curriculum has more of been developed as a global curriculum, but countries can adapt and have it as per their national standards that would meet their national needs. The sample curriculum also covers the different learning and teaching strategies, which is the other category under the global standards. Next slide, Kate. And with the shift from knowledge-based to competency-based learning, also shown in the Circle of Learning framework in the slide, it is important that, maybe next slide you could go to, yeah. It is important that the faculty members have been equipped with the right competencies on emphasizing not only in the knowledge part, but mostly also on the hands-on skills, decision-making, critical thinking, and team-based simulation learning. And I think I would also want to emphasize on using data for the continuous learning and assessments. Globally, we see that there is a quantity gap for midwives. However, while covering the quantity gap, we need to ensure that we are not compromising on the quality. Thus, the different teaching learning strategies that is a part of the standard now is really important. The different teaching learning strategies we believe need to be more learner-centered. Peer-to-peer learning should be encouraged. Promotion of interprofessional training and reflective learning is also really important to enhance the collaboration and critical thinking. Also, we see that midwifery students, they like to adapt and learn through digital tools and innovative solutions. Thus, integrating these digital tools, e-learning modules for blended learning approaches is the need of the hour, and also ensures scalability in low resource settings and is very crucial for humanitarian settings too. The picture here is, you can see Olive, I think many of you in the call would know her as a midwifery leader, is from a faculty development program in Rwanda, which was developed in collaboration with UNFPA and the Ministry of Health there. Along with the faculty development program, the faculty development program included all the different strategies that I have touched upon here. But I would want to link it with the curriculum, that the country also revised their national midwifery curriculum and integrated the different strategies and the faculty development program as a part of the curriculum as well. And I think there is so much to learn from there, and the leaders like Olive would be able to share more around that. Next slide, Kate. Similar other faculty development programs are also being developed in other countries. These are a few of the pictures of the faculty development program from Nepal. And we see that there is a need of such faculty development programs globally. And I personally really believe that the global standards that has been now developed by ICM along with partners would really help in developing competent faculty and competent midwives. I will just stop here for now, and over to you, Kate.
Thanks, Asmita. I'm really grateful for your insights. I'm now going to hand over to Marlon, who's just going to talk through using the faculty standards through research and implementation. Thanks, Marlon.
Hi, thank you, Kate, and warm greetings, everyone. So my name is Malin Bogren, and I'm a professor at the University of Gothenburg. And today I will present how we can apply the new ICM Global Midwife Faculty Standards using evidence from a national study which we conducted in Bangladesh. So as we have heard, faculty competencies is the foundation of high quality midwifery education. And Bangladesh is a country that has rapidly expanded midwifery education nationwide. And the readiness of the faculty has then become uneven. And we at the University of Gothenburg are working closely together with the United Nations Population Fund and the Directorate of Nursing and Midwifery in Bangladesh to establish an internal quality assurance process that can help education institutions to meet the national accreditation standards. But an internal quality assurance system depends on faculty who are fully prepared, and not only clinically, but also pedagogically, academically, and in leadership roles. So this study was designed to understand exactly what professional development needs the midwifery faculty had, so that national investment can be targeted where they matter at most. So we conducted a national survey across 31 midwifery institutions with 118 faculty participating. And the survey tool was originally developed by Rachel Smith and her team at the Burnett Institute, and we adapted it into the Bangladesh context to ensure the relevance and culture fit. And we combined quantitative data with open text comments to get a deeper understanding of what the faculty needs were in Bangladesh. And we assessed 4 major areas, which were education and pedagogy, research capacity, leadership and management, and preferences for continuing professional development. And this approach allowed us to link faculty needs directly to the new ICM Global Faculty Standards. So just a snapshot of the findings will be presented here as they are yet not published. But the strongest need we found in the domain of education and pedagogy, it was the strongest need that was found in this domain. And over 40% of the faculty reported needing more competence in midwifery theory, and nearly the same number needed training in clinical teaching and simulation-based learning. Next slide. And the second major need was the development of research and scholarly skills, where about 37% of the faculty indicated they needed support in manuscript writing, and 32% needed training in research design and methods. And many faculty expressed that they rarely had an opportunity to engage in research and academic work. Next slide, please. And faculty also reported a strong need for leadership development. 36% expressed the need for training in leadership, management, and quality improvement. And many commented that while they carry heavy responsibilities at the institution, they lack formal preparation for academic leadership and have limited guidance on career pathways. Next slide. So when we asked faculty about the preferred modes of learning, the results were very clear. A majority, 53%, preferred fully face-to-face learning, and another 42% preferred blended formats with a in-person in-person component. And the preferred schedule was an intensive 10-day program over 2 weeks. Next, please. So when we triangulated the quantitative survey results with the open text comments, we could see a very clear pattern that emerged. And we were able to map our findings directly into the 7 of the ICM Global Midwife Faculty Standards. I'm not going to go through all the standards and what we found under each of them, but together this mapping shows that the ICM standards offer a high, previous slides, by mapping these findings shows that the ICM standards offer a highly relevant and practical framework for guiding natural implementation and for prioritizing investment in faculty development. Next slide. So these findings matters because they allow us to target investments where the needs are greatest. And implementing the ICM standards, as we see it, requires first understanding the needs of the faculty. And it also shows that faculty development is not optional. It's a core element of quality, educational strengthening, and to meet national accreditation standards. Next. And what we see in Bangladesh mirrors findings across the Southeast Asia and other low middle income countries. And faculty often transition from clinical roles without adequate pedagogical or leadership preparation. And faculty development must be systematic, long-term, and embedded in national directives, not sporadic or project-based. And aligning national CPD with the ICM standards creates a consistent global benchmark for quality. And faculty development cannot stand alone. It must be linked to institutional quality improvement processes. Next. And as a final takeaway, the ICM Midwife Faculty Standards offer a clear pathway for strengthening midwifery education. They promote evidence-based driven professional development, encourage strong partnership across institutions, and support context-sensitive implementation tailored to faculty needs. And together, these elements make the ICM standards a powerful framework for advancing high-quality midwifery education. Thank you.
Thanks, Marlin. Some really important points there around kind of linking faculty development around the wider institutional development and context in the country. Really helpful there. So we've only got time probably for a couple of questions, and I can see that a lot of the faculty have been answering them as we go. But there was one quick question here around why do we use midwife faculty rather than midwifery faculty? And hopefully I touched on that a little bit in my conversation, but the midwifery faculty is the broader group of health professionals that might teach midwives or pre-service student midwives in programs. However, these standards are aimed specifically at midwives because we're talking about the midwifery philosophy of care, the requirements of midwife educators to maintain midwifery competence in practice. And this may not apply to other educators who are supporting the midwifery program. So that's why we use the term specifically midwife here rather than midwifery, which sometimes covers a much broader group of people or ideas around people in the program. There was a question about AI in midwifery education. I don't know if anyone would like to answer that. I think that's quite topical at the moment. Where do we see AI in midwifery education and how might that support that?
Okay,
Great, yeah.
did answer that in a text-based answer. And it's a very big question and deserves its own probably week-long conference.
Yeah.
But all that I've said is that AI is here to stay and to evolve. Our students will be using it to support their learning, and we use it to support our work. So our education institutions, our regulatory authorities, and our associations need to consider the use and provide direction through clear policy and guidance. But as many of you will know and will already be using AI to support the work that we do in educational development, work that we do in faculty development, the work that we do in teaching and learning and in research, we need to consider ethical use of AI and consider the impact of AI on our students' learning and on our assessment processes within our curriculum. But it is a very large and evolving topic, and maybe it's something that we can do have some discussions around.
Thanks, Rachel. Really good points there. And as we found already from kind of Duncan's systematic review, we lack a lot of research and evidence around faculty development in general. And I certainly think AI is one of those growing areas where we don't yet have a really full assessment around, what are the benefits, but maybe what are the risks of AI in midwifery education. So hopefully we'll be growing on that work. I'm just going to touch on one last question before we need to go, really, because I'm going to hand over to Anna to close. But there was a question around, as health professionals, education continues to grow, how can midwifery educators perhaps engage with other health professional groups and other educators to raise the visibility and professionalism of midwifery? And I thought that was a really good point. While we're talking about midwife faculty development, we touched on a couple of the themes around interprofessional collaboration and looking at how we can strengthen those professional relationships right at the pre-service level. So, thinking about, are there opportunities for shared modules? How might students and faculty be working together to strengthen education? But within that, it's really critical that we hold on to the midwifery philosophy and that midwifery educators are predominantly teaching student midwives. and making sure that each other understand each other's complementary roles within health systems. So I think this is a growing area of development, and certainly there's opportunities for midwifery education to be working with other midwifery educators at some points of the program to help strengthen interprofessional collaboration and relationships. So we'll continue to answer some questions in the chat as we go. Just a couple of other things before I hand over to Anna. Just to let you all know about the AIME website. So the Alliance to Improve Midwifery Education does have its website now. We're going to be dropping that information into the chat. Please go and have a look. It's hopefully a global repository of really important policy, documents, research. We also share events on there. If you have a paper that you've published or an event around midwifery education that you think should be shared on that website, then there is a link on the website where you can get in touch with us and tell us about that, and we'll do our very best to showcase it. We want the website to make lives for midwifery educators as easy as possible by sharing and disseminating resources in different settings and having kind of a one-stop shop for all things around midwifery education. Just a reminder, if you're interested or need any support with midwife faculty development in your context, then do reach out to ICM. We're always looking to work with different countries, institutions or organisations, and we can help guide you into various resources. We also have the second webinar next week, which is going to be really, really interesting, looking at how do midwifery educators maintain clinical practice competence. And we have got some country examples where some programs are linked to the regulatory authority and continuous CPD, and then in other settings where maybe that isn't so well established. So do join us next week. It will be a panel discussion with plenty of time for Q&A so that we can find out about different models, how different individual midwifery educators are managing this, or how you might be managing it at an institution or a country level. And then I'm going to hand over to our wonderful Chief Executive, if she is here. I can't see you, but hopefully you are, to just have some closing remarks for this session. Over to you, Anna.
Absolutely, Kate. I'm here. Do you hear me?
Great. Yeah, I can. Thank you.
And thank you, everyone. This is a topic very, very close to my heart, as many of you know. And it has been a huge pleasure to listen to wonderful presentations, very, very good presentations, summarizing to where we are at right now. So I really would like to start by thanking all the participants. I've seen that we have been up to 360 participants in this webinar today, which is impressive. And I have loved the conversations in the chat and the Q&A. So thank you very much from all over the world for what you have shared and the questions and the dialogue that is on there. I think that's really important for all of us. Why is the ICM Global Standards for Midwife Faculty essential? Well, it is. The midwifery faculty is really essential to education quality for women and newborn health. So we should never forget that. Strong faculty is a strong midwifery program and a strong midwife upon graduation and providing very good quality care to women and newborns throughout her life cycle. So the midwifery faculty is really the backbone, definitely. Often the midwifery faculty is overlooked, under-resourced, or we don't have the skills. And I've seen some of the chat of how to maintain and get clinical skills, which is a concern for many. So this is really what we hope that the Global Standards for Midwife Faculty can help you with. Summary for today is that we've introduced the ICM Global Standards for Midwife Faculty Development, with really clear benchmarks, practical and evidence-informed guidance, and also focused on leadership, the curriculum. We are very excited with the UNFPA ICM sample curriculum coming up in next year. The partnerships, the resources, the clinical competencies, and research. So it has been a very comprehensive webinar. we really encourage you for next steps for all of you to actually use the standards as a tool for review, planning, and strengthening your own program. So please visit them, please read them, and start the discussions where you are within your institution and regulatory bodies on how to improve the faculty and the programs. And let us know, as Kate said, if we can help you in any way there. From AIME, the Alliance for Improved Midwifery Education, we are really committed to ongoing collaboration, and we invite you to use all the ICM and all the other resources that is available for you. And finally, also encourage you all to use the QR code in my background and on the screen to encourage and sign the petition for 1 million more midwives. And this is exactly linked to what the webinar today has been all about, our future midwives, our future sisters and brothers who will provide care for women all over the world. Thank you, everyone who has presented. It has been great to listen to you. And please don't forget to register next week for the 10th of December for a more in-depth webinar on the Standard 6, Midwifery Faculty Maintaining Competence in Practice. So thank you all, and thank you behind the screens as well. There has been a lot of support from interpreters and from Bruna and the team at the ICM in Hague, and looking forward to the next webinar. Thank you, and over.
Thanks all. See you next week, hopefully. Bye.